it is located between superior part of medial surface of the thigh. Okay? They are the medial surface and superior part of the thigh. If I want to say that where is the surface anatomy of the anterior part, I say that in the male anterior part of the perineum arrive to the scrotum. In the female, it extends to the mons pubis anteriorly. And posteriorly, I say that perineum is located inferior to the buttock. Okay? Here we have the buttock, inferior to buttock. It is the location of perineum in the surface anatomy. Okay? What is this position? Dictotomy position. Yes. So, the boundaries of perineum after surface anatomy, when I remove the skin and some of the muscles, I should describe the boundaries of the perineum. I say that it has anterior, posterior, two posterolateral and two anterolateral boundary. Anteriorly is pubic symphysis, posteriorly is tip of coccyx, posterolateral is these ligaments which originate from sacrum attached to attached to tuberosity of the ischium, which is named sacrotuberosity ligament. And anterolateral, we have the inferior ramus of the pubic bone, which attached to ramus of the ischium and made ischium, pubic ramus. It is the boundary of the perineum. I divided the perineum into two triangles. Okay? Look at here. Anterior triangle, posterior triangle. These two triangles are created by an imaginary line which connected the median part of the tuberosity together. Okay? The median part of the ischial tuberosity together, and I named it interischial line. Okay, interischial line. So, these two triangles in the normal position of the pelvic are located opposite together. Look at here. This is the normal position of the pelvic in your body. For example, here, ACs. What is ACs?
Anterior superior index spine.
In the normal position, ACs is located at the level of
Promontorium.
Yes, sacral promontory. Yes. Here, the superior border of the pubic symphysis is located at the level of tip of coccyx. Okay? It is the abnormal position of the pelvic. So, I can say that in the normal position, the anterior triangle, which also is named urogenital triangle, is located in the horizontal plane. Okay, in the horizontal plane. But posterior triangle is located in the vertical plane. But for the study, for the teaching, okay, I draw these two triangles in just one plane. But you should know that in the anatomical position, they are located in different planes in the body. Why we name this as urogenital triangle?
It has the urinary orifice and the genital orifice.
Yes, urinary and genital structure are located in this area. In the male, here just we have urethra. In the female, we have
urethra and vaginal
and vagina. Offering. Offering means?
Correct. Oh, good job.
Correct, good job, yes. Here, posterior triangle is named anal triangle. Because yes, anus is located in this area. the anal triangle, like every part of the body, the skin, superficial fascia, deep fascia, and the structures which are located in the superficial fascia or deep fascia or deeper to deep fascia. The first, as you can see, after the skin, we have the superficial fascia, which is created by the fatty tissue. Yes, look at here. All of these are fatty tissue. Which muscle is this?
Maximus?
Yes, gluteus maximus. Gluteus maximus made the bulging of your buttock. Yes, I said that in the surface anatomy, the perineum is located inferior to buttock. So this area is perineum, this is anal triangle. The superficial fascia of the anal triangle is created by a large amount of the fatty tissue, which this fatty tissue is located in all of this area and around the anus. Another structure in this area, look at here, the deep fascia. Deep fascia is occurred by the fascia of this muscle. Which muscle is this? Which muscle is this?
Levator ani?
Levator ani muscle. Yes, levator ani muscle. Another structure in this area. And as you know, levator ani muscle has two fascia. One fascia is located in the superior part of levator ani and is located in the pelvic cavity. One fascia is located in the inferior surface of levator ani. Look at here, for example, this fascia. Okay, it is inferior fascia of levator ani, which is located in this area. Another structure. Look at this structure. What is this? A ligament. Which ligament?
Anal.
Anococcygeal ligaments. Anococcygeal ligaments attach posterior part of the sphincter, external anal sphincter to the
Coccyx.
of the coccyx. Which muscle is this?
Hyporectalis?
No, puborectalis is a part of levator ani. Okay, is a part of levator ani, and this is levator ani. Look at this muscle; it is located
Around the
circularly and
Around the anus.
Around the anus, it is
Anal sphincter.
external anal sphincter. External anal sphincter is a smooth or a striated muscle.
Striated.
A striated muscle, yes. When I say that a muscle is striated, I mean that it is innervated by
Somatic.
somatic nerve, yes, and it is
Under
voluntary.
article.
It is voluntary muscle. So, it is external anal sphincter. External anal sphincter posteriorly attached to anococcygeal ligament, and anteriorly in this area we have a dense fibromuscular structure which is named perineal body. Okay, perineal body is a dense body, is a strong fibromuscular structure which is located at the level of interischial line in the midline. Okay, it was interischial line, it is the midline, and perineal body is the junction of attachment of the muscles which are located in this area. Here, look at two perineal body. I said that here I have the urogenital triangle, and here I have anal triangle. Okay, at the level of urogenital and anal triangle in this area, I have a dense fibromuscular tissue which is named perineal body. What is the function of perineal body? I say that
Site
10
attachments.
muscles, 10 muscles attached to perineal body. Okay? Two of them are unpaired muscles. Which muscle?
External anal sphincter.
Yes, external anal sphincter. And as you know, in the medial to the external anal sphincter, lateral to this muscle, also we have another muscle which is a smooth muscle, yes? The muscles which cover your gastrointestinal system, we have two types of muscle, circular muscle and longitudinal. Okay, circular is inner muscle, yes, longitudinal is outer muscle. This longitudinal muscle, when travel inferiorly, arrive to the rectum, yes, after the rectum arrive to anal canal. So, after anal canal, it ends and at this area. So, longitudinal muscle of the anal canal also attached to perineal body. Another muscles which ending in the perineal body. In the lateral side, this muscle. What is this? Levator ani. Yes, levator ani, which originates from lateral part of your pelvic, okay, and travel inferiorly and medially, and this fiber, some of this fiber, arrive to the perineal body. Another muscle, look at here. Look at this muscle. Okay? This muscle has two types. This one type is located superficially, one type is located deep to this muscle. Is named deep, okay? Superficial and deep transverse perineal muscle. Because the direction of the fiber is transversely, okay? This is superficial transverse perineal and deep to this muscle in this area. Look at this area, okay? It is named deep transverse perineal muscle. These muscles also attached to perineal body, okay? And they are paired. Another paired muscle is this muscle. Look at here, bulbospongiosus muscle. Bulbospongiosus muscle in the male perineum, just we have one ball, but in the female we have two balls, which are named ball of vestibule, and in the male is named ball of penis. Okay, but in both men and women we have two bulbospongiosus muscle. In the female are completely separated together, but in the male are partially separated by a median ruffle. Okay, this was 10 muscles which end at the perineal body. So, we are assessing the structure of the anal triangle. Yes, I said that anal triangle superficial is made by the superficial fascia, which is made by the fatty tissue. Look at here, this is fatty tissue. The deep fascia of this area, and in the midline, what is this section? Coronal section. Yes. If look at here, what is this? Ligament sacrosuberous ligament. Yes. This is ischiopubicus. What are these?
Ischiopubicus.
Okay, so this is anus. Okay, and this is, for example, urethra in the knee. If I want to draw a section at the level of anus, at the level of anus in this area, but I should draw it better. As you know, ischial tuberosity is very large. Yes, the body of ischium is very large here and here. Okay, if I draw a section at this level, okay, and I want to show you that which structure are located in this level. Which structure are located in this level? In the coronal section. This section is coronal, yes? If I want to section is coronal. So, laterally in the coronal section, laterally which structure is located? Yes, laterally I can say the ischial tuberosity. And in the midline I have
Anus.
anal canal. Yes, anus and anal canal. So the anal canal in this area, I say that if it is the anal canal, from anal canal, here we have another muscle. Which muscle?
Levator ani.
Levator ani muscle. Yes, levator ani muscle. Here, at the level of ischial tuberosity, in the medial side, I have obturator internus muscle. Yes? Do you remember?
Yes.
We have two obturator. Obturator internus, externus. At this level, I have obturator internus muscle. Yes? Okay? Obturator internus. Here and here. Obturator internus has the fascia. All the muscles have the fascia, yes? So, this is the fascia of obturator muscle. And also, the levator ani has two fascia. It is inferior fascia and another fascia is superior fascia in this level and at this level. So, as you can see, I say that I have a circular muscle in this area which covers the anal canal. Yes? This muscle is
Internal.
external anal sphincter. External anal sphincter has three parts. Okay? It has three parts. One part, two parts, and three parts. These three parts are named here subcutaneous part, okay? Subcutaneous. Here is superficial, and this is deep part. They are three parts of the external anal sphincter. Where is the location of internal anal sphincter?
Internal anus. It should be the deep part, right?
Yes, it is deep part. So, internal anal sphincter is located in this area, yes? Yes?
Yeah.
It is internal anal sphincter. Do you know the white line of Hilton?
Oh.
So-
Golden. Right hand.
No, not golden line. Golden line is located in the fascia of the abdominal wall. But white line of Hilton is this area. Okay? It is the area which external part of anal canal is separated from the internal part of anal canal. For example, this part is covered by the skin, but this part is covered by the mucosa. Yes. So, internal anal sphincter, okay, ends at this area, ends at this area, and this muscle is circular layer or longitudinal.
Circular.
No,
Longitudinal.
longitudinal. Yes, it is the longitudinal muscle which ending at this area and then this fascia attached to a fascia. This longitudinal muscle attached to a fascia, which this fascia well, laterally to arrive to this area. Okay? Travel laterally to arrive to the fascia of obturator internus. Yes, this is fascia of obturator internus. Okay? What is the name of this fascia? This is
Deep.
pre-anal fascia. Okay? Pre-anal fascia is derived from the fascia of longitudinal muscles. Longitudinal muscle of anal canal are the same in which sphincter?
External. Internal.
Internal
Sorry.
sphincter. Okay? So, what is the name? Also here at this level, I said that they are a striated muscle. A striated muscle like the levator ani muscle should have a fascia. Yes? Yes? This fascia, which covers this muscle, look at here, superiorly attached to this fascia, because I said that always in our body, superficial fascia are located continuously. Deep fascia is continuously. So, it is a deep fascia. This fascia is deep fascia because it's fascia of the striated muscle of the external anal sphincter. Also, this fascia is a deep fascia of levator ani muscle. These two fascia attached together. Okay? What is the name of this fascia? This inferior fascia of levator ani. What is the name of this fascia? This anal fascia. Anal fascia, it is the fascia which covers the external anal sphincter. This is anal fascia. Okay? So, what is this layer? What is this layer?
Superficial anal fascia. Superficial anal skin.
Skin.
Mm.
It is a skin.
Mm.
Okay? So, it is a skin. And as you know, I made two space in this area. Yes? All of this space and this space are named ischio-anal fossa. Okay? Ischio-anal fossa. But I say that pre-anal fascia divided the ischio-anal fossa in two parts. This part is the main ischio. I name this part as ischio-anal space, ischio-anal space, or the main part of ischio-anal fossa, and I name this part as pre-anal space. Okay? Pre-anal space, ischio-anal space, or ischio-anal fossa. The structure of these two spaces, they are different. The first, you should know that all of these spaces are covered by fat. This fat is the category of superficial fascia or deep fascia. Superficial fascia. All of this area are superficial fascia. The difference of the fat in the superficial fascia at this area is that you know that the adipocyte attached together and made the lacuna. Yes? At this area, I have a small lacuna which are separated by complete septums. Yeah? I have some septums which completely separate this lacuna. But at this area, at the ischial-anal fossa, I have greater lacuna which separated by incomplete septums. Okay? Separated by incomplete septums. So, what do you think if the patient have inflammation at this space or this space? Which of them is more painful?
Should be
The
superficial.
one near the skin?
The inflammation at this area is painful
No.
or this area?
That one.
No, I think internal and deep is more painful.
Deep, why?
Because,
the nerve?
yes.
Compress the nerves?
In general, I think the deep area has more, like more, if something were to happen there, inflammation would be more compressed, it would cause more pain. Whereas superficial is just from the.
In the perianal space, because there is already, you said there is space between them, so even if there is inflammation.
This is painful?
No. Yeah.
Yes. 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 The inflammation of this area is painful. Because I said that complete septum are separating all of this area. So, if I have accumulation of the pus or inflammation in a small area, it made a pressure. Yes, it is very painful. The inflammation of this area are very painful. But inflammation of this area, it is not painful because here we have large lacuna of the fatty tissue which are separated by incomplete septums. So, which inflammation is susceptible to inspirit?
The ischial.
Yes, ischial-anal. So that if we have an inflammation in the ischial-anal space, okay, for example, if this in this area, if we have an inflammation or in this area, it may insert to the skin the inflammation, or it may travel medially to insert to the mucosa of the anal canal. Okay? For example, maybe this inflammation arrived this area. Yes? Or maybe the inflammation arrived to the skin. Yes? What is the name? What is the name of this accident? It is named fistula. Fistula. Ischio-anal fistula. It is occurred when the inflammation is occurred in the ischio-anal space and travel medially to insert to this area. And for example, during the examination, you insert a speculum in the anus of the patient, and you can see that you have an orifice in the wall of the anal canal. What is the sign of this patient?
Pain.
Bleeding?
Pain.
Pus discharge from.
Yes, the main sign is pus discharge. Okay, because here we have
Pus.
inflammation and we have the pus, and the pus is discharged in this area, and also we have the pain. But if we have a direction to the skin in this area, we call it sinus. Yes? If what is the difference of cyst and sinus?
Sinus is false place.
Sinus is
I think cyst is full of pus, but sinus is full of blood, correct?
no. The cyst can be the cyst is accumulation of the pus which has some boundaries. Okay?
So it's closed.
It is closed.
Yeah.
It is closed, yes.
Sinus
But-
is not-
But if the cyst arrive to the skin, it is named sinus. So this patient, if this inflammation arrived to the skin, we named it ischial-anal sinus if arrived to the mucosa of the anal canal, we name it ischioanal fistula. Okay? So, as you know, we should have some innervation in this area. The innervation of the skin of ischioanal fossa, okay, is supplied by, yes, from pudendal nerve, inferior rectal nerve, inferior rectal nerve, and cranial branch of S4, fourth sacral nerve. Okay, these two nerves make the innervation of the skin of the of the anal triangle. All of this area, the anal triangle. Okay, but at this area, you can see another structure. For example, look at this structure. What do you think about this structure?
Which one?
Which nerve and which artery?
Hi.
I am talking about the perineum. Yes, I said that the most part of the perineum is innervated by pudendal nerve and is supplied by which artery? Internal pudendal artery.
Is this pudendal neurovascular bundle?
Yes. This neurovascular bundle is internal pudendal artery, internal pudendal vein, and pudendal nerve. Okay? Which, as you know, for example, internal pudendal artery, it is a branch of internal iliac. At the pelvic floor, okay, this artery travel and insert to the space between coccygeus muscle and the levator ani muscle and go to the glottal area. After arrive to glottal area, it turn around ischial spine and then arrive to this area, arrive to perineal part. At the perineal part, you can see this neurovascular bundle in the lateral wall of the ischioanal fossa. Okay? So, the ischioanal fossa has this structure, contains the fatty tissue, contains the nerve, contains neurovascular bundle. All of these structures are located in a fascia, a canal, which this canal is created by the fascia. Okay? So, at this area, I say that I have the neurovascular bundle, yes, which are located in a canal. What is the name of this canal?
Pudendal.
Yes, pudendal canal, or also is named Alcock. Yes, Alcock or pudendal canal. Okay? Which fascia contributes to make this canal?
The obturator teres fascia.
This is the canal. Which fascia? The first?
Obturator fascia.
Yes, fascia of obturator internus. Another fascia,
Perineum.
perineal fascia, also contribute to make this canal. Another fascia is named leonate fascia. What means leonate?
Newborn. Infant.
What means leonate?
Leonate.
Moon shape,
Yeah,
yes.
moon.
Semi-moon shape, yes.
Leonate.
Okay? This is named leonate fascia. Leonate fascia. Okay?
Another part which contribute to this area is some part of the sacrotuberous ligament. As you know, sacrotuberous ligament attached to ischial tuberosity, yes? Some part of the sacrotuberous ligament at this area contribute to make this channel, which is named falciform process. Falciform process is some part of the sacrotuberous ligament which contribute to this area. Also look at this area. The lunate fascia made two different parts. This part is named suprategmental. Okay? Suprategmental space. And this space is tegmental space. Suprategmental space, tegmental space are separated by the lunate fascia. Okay? Another structure in this area. At this area, from the internal pudendal artery, I have a branch which go medially. We have a branch which transfers medially and transfers passes the ischioanal space to make supply for all of this structure. Yes? This is named inferior rectal artery. Also from the nerve at this level, I have a branch which travel horizontally and arrive to this area. It is named inferior rectal nerve. So inferior rectal nerve and artery are some of the structures which are located in the ischioanal fossa. Another structure in the ischioanal fossa. I said that here we have sacrotuberous ligament. Yes? Sacrotuberous ligament is pierced by perforating nerve here. Here I have perforating nerve from S2 and S3. What is the function of perforating nerve? No, they are sensory nerve.
For
They
skin?
supply the skin of
Perianal triangle.
the skin of your buttock, of your gluteal area which covers this ligament. Okay? At this area, the skin of your gluteal part which covers this ligament is innervated by perforating nerve from S2 and 3. Also, this nerve are seen in this space, are seen in the ischioanal space. Okay? Another structure which we can see in this space. Here I said that inferior rectal and perineal branch of S4. Also, perineal branch of S4 can be seen in the ischioanal fossa. Okay? The ischioanal fossa is located in bilateral, in the left side and right side. But it has a limitation. For example, anteriorly, this is perineal membrane. Okay, anteriorly is limited by the perineal membrane. Posteriorly is limited by gluteus maximus. Yes, but it has some recess. These recesses are spread to anterior and to posterior. Anteriorly, look at here. If I draw out the perineal membrane, I can see that this space is spread to this area. It is named anterior recess. Anterior recess.
Also at the posterior, go to the depths of the gluteus maximus and go to the depths of the subclavicular ligament. It is named posterior recess. Another recess is named horseshoe recess. Look at here. Horseshoe recess connect two ischial-anal fossa from right and left. Okay? This is three recesses of ischial-anal fossa. So,
Missed 5 minutes. Oh, 5 دقائق.
شو شغال مش شغال
the anterior. If I have a parasagittal section, at the level of anal triangle. Which structure I can see in the parasagittal section? Anteriorly, I can see the body of pubic bone. Okay? Yeah. Anteriorly, I can see the body of pubic bone. Posteriorly, which structure is seen? Yes, gluteus maximus. Gluteus maximus is seen posteriorly. Okay, and here between these two muscles I have levator ani. Okay, between these two muscles I have levator ani. Can I see the anal canal in this area? No, because I am doing a parasagittal section. Anal canal is located at the median sagittal section. Okay? So, this is levator ani. What is this fascia? Inferior fascia of levator ani. Okay? And at this area, inferiorly, I have the perineal membrane. Perineal membrane is some part of the deep fascia, okay, which is located in the anterior triangle. Is located at the anterior triangle. Inferior to perineal membrane, I have a superficial fascia. Yes. What is the name of superficial fascia? In the perineum? Colles fascia. Yes. Colles fascia posteriorly attached to perineal membrane. It is perineal membrane. Colles fascia posteriorly attached to perineal membrane. At this area, it was urogenital triangle. Posteriorly at the anal triangle. Okay? At the anal triangle, I said that. زنده باشید. So, look at here. Look at the posterior triangle. My deep fascia in the posterior triangle is inferior fascia of levator ani. What is superficial fascia in the posterior triangle?
The preanal?
Preanal, yes. Preanal fascia is the superficial fascia which anteriorly attached to Colles fascia. Because I said that superficial fascia are located continuously, okay? Colles fascia attached to perianal fascia. So I want to show you the recess of the ischial-anal fossa. Ischial-anal fossa has a main part, okay? This is the main part. This is posterior recess, and at this level I have the subprotuberous ligament. Okay? This is posterior recess and this is anterior recess. Anterior, here is posterior. Anterior recess of the ischial fossa is located depth upper to cranial membrane. Okay? Posterior recess is located in the depth and superior to subprotuberous ligament. Posterior recess of ischial fossa arrive to which muscle? Gluteus maximus muscle. Okay? So,